So, scientific communication is the process of informing, teaching, and promoting scientific related issues and fostering astonishment in the wake of scientific arguments and discovery. That can be in the form of journals, articles, and research that is done in the common practice of facilities or research facilities. This is a great way to improve research development and to improve the practice of taking care of patients as a whole. The implications of human research as it applies to healthcare is that it should be an ethical way and it should be the way it is conducted. Those being at least subjects that know about the medication, like the side effects that may or may not happen. It should be a consent and signed an acknowledgement for that to be part of the scientific research. Those that have been performing research without subjects knowing isn't a violation of healthcare standards. For example, in 1913 to 1951, Dr. Leo Stanley, a chief surgeon at San Quentin Prison, performed a wide variety of experiments on hundreds of prisoners at San Quentin. Many of those that were experimented on involved testicular implants, where Stanley would take the testicles out of executed prisoners and surgically implant them into living prisoners. In other experiments, he attempted to implant testicles of rams, goats, boars into living prisoners. Stanley also performed various experiments and forced sterilization on prisoners. So we can see that that's also an implication of what's wrong. There's other been cases where the mentally ill have been treated on, like in Northern California in Simona State Hospital in 1955 to 1960, children went under painful experimentation without adult consent. And since they're minors, they should have adult consent for that to be given. Many were given spinal taps for which they received no direct benefit from it. And, even those that had cerebral palsy died at Simona State because of without parental consent. A very famous other one is where the Tuskegee Airmen, where the syphilis experiment was conducted on Negro Americans. It was done in Alabama by the U.S. Public Health Services. These were 399 black males who were given syphilis and offered so-called treatment for research, and they did not receive any treatment for the disease. Rather, they just charted the disease process on these men. In 1947, penicillin became available for treatment during the study, and some weren't even given the treatment, and basically a lot of them died from it. Another code of ethics could be, World War II, where many of the Nazi regime experimented on Jews and other people, and it was unethical. And so these are the kind of unethical things that can be done when there isn't consent or knowledge of what the research could possibly be done in the allied health profession. Communication should be addressed to patients and their families whenever you're about to perform a procedure to a patient. You should always introduce yourself, explain the plan of the outcome. Physicians should also be explaining the plan of care prior to healthcare professionals coming in and working on the patient. Each care professional has a limited scope of practice and can only explain what they're going to do and what's going to happen. They cannot speak for other healthcare professionals. So therefore, that's the reason for the communication between this, is that, the healthcare team should be communicating within themselves too to help that patient have a better outcome. Other ways that corresponding between different health professions is maybe, in the notes or when there's rounding being performed on the patient. In healthcare, there's like notes, or vital ways to correspond to other healthcares by phones. Some have cell phones, some have Volt phones and stuff like that to communicate between each other. Texting as well. Lab values is another way that healthcare professionals can tell what's going on when they order it. And then if there's an abnormal value, call that healthcare professional, like the physician or the nurse, and inform them that there's a lab value that's out of whack. It could also help with upcoming procedures and time of plan of care if it's done correctly. If there isn't, then it could hold the plan of care for a patient going to surgery. This is a great way for healthcare professionals to work at it and can root out ineffective communication throughout. Because, sometimes there is bad communication between the healthcare providers.